My name is Fiona Pringle and I'm the Clinical Nurse Manager at the Oxford Fertility Unit. I'm here today to show you how to administer your Menopur. You've been prescribed Menopur to use by your clinic. This box contains 600 international units of Menopur. It comes as a multi-dose vial and everything you need for mixing the drug and administering it is contained within this box. You should also have received a blue kit bag which contains information sheets about mixing the drug and a sharps box where you can dispose of all your used needles and syringes. When you're ready to administer the drugs, make sure you've got a clean, dry surface and that you've washed your hands before dealing with the drugs. When you open the box, inside there are an orange-topped vial of white powder, a syringe containing a diluent and a needle for attaching to the diluent syringe in order to mix the drug, and a white box containing needles and syringes in order to administer the drugs. To mix the drugs, first open the packet, bend the corner back and then pull apart. Take the powder, the top flips off, so put your thumbnail underneath the top and flip it off. You will see a rubber bung in the centre of the vial. Take the syringe, which is already preloaded with the diluent. Take the grey cap off it. Take the needle. In order to break the seal, just unscrew the top. It's a grey needle and push it firmly onto the syringe with the diluent and then pull the cap off. Place the needle through the centre of the rubber bung and slowly inject the diluent into the white powder. It should dissolve immediately. Once you've injected all the diluent, make sure your needle is above the level of the liquid before removing the needle and syringe. And whilst removing the needle and syringe, ensure that you keep your thumb pressed firmly down on the plunger until the needle is finally out through the rubber bung. Your needle and syringe can now be disposed of in your sharps bin. You now have 600 units of Menopur in the vial. Before you use it, you just need to ensure that all the powder has properly dissolved. If it hasn't, then just slowly rotate the vial in a circular motion until any tiny white specks of powder are fully dissolved. This is now ready to use. Once you have mixed the drug, you can now safely store it at room temperature for up to 28 days. Your syringe is measured in international units, and your clinic will have told you exactly how many international units they want you to administer on a daily basis. The needle is already attached to the syringe, so pull the cap off. And this needle is used both for drawing up the drug and for administering it. Place the needle through the centre of the rubber bung, preferably using the same hole that you used to mix the drug. Once the needle is inserted into the rubber bung, turn the vial and the syringe upside down and slowly pull the plunger out. You need the top of the plunger, the black line, to be level with the dose of drug that you are going to be administering. Once you are happy that you have got this right, turn the vial and the syringe the right way up and slowly pull out the needle. You are now ready to administer the drug, and your clinic will have told you the best injection site to use.